Daniel Rosa, MD. I'm the Senior Medical Director here at Acacia, Clay Avenue Division. And I was born and raised in the South Bronx. Both of them were native Puerto Ricans. One was born on the eastern part of Puerto Rico, which is Aguas Buenas, Puerto Rico. My mother in Isabela, Puerto Rico. Both of them came in the 40s or 50s to New York. The thing is that when you live in the South Bronx, you kind of accept a certain degree of poverty simply because everyone who's pretty much around you lives under the same circumstances and the same tenements and at about the same level of income if they have any income. I went to James Monroe High School, which is nearby. I always loved reading and I always kind of like self-educating myself. Sometimes I basically am a product of the public school system. But it wasn't until college I attended Fordham University as an undergraduate that I really started standing out as far as the professors were concerned. I applied to several medical schools. I was accepted to quite a number of them, but I finally decided to go to Harvard Medical School, which is in Boston, Massachusetts. It was always my intention to come back to the South Bronx. I was very comfortable. I was an associate professor of emergency medicine, and I was working at St. Vincent's Hospital. But about 2 weeks before my father passed away, he reminded me, we were actually watching the funeral of John Paul II. He said, you know, you, out of the blue, he says, you know, you said to me many, many years ago that you were going to go back to your community and serve your population. You haven't done that. And then he passed, and I couldn't get that out of my head. It was like a bolt of lightning. I couldn't shake it. I saw a flyer somewhere that they were looking right here in Mount Hope area of the South Bronx, deep in the South Bronx, that they were looking for a medical director. So I applied. About a month later, no, I didn't get an answer, so I said, at least I tried, okay? And now I feel, you know, justified in not pursuing this anymore. And about a week after that, I got a phone call, and they wanted to take me. And when you start doing this kind of work, I had no idea that it was going to become my mission. Here, it's a lot more deep-seated, the issues. You have to search, you really have to give it time to get to the root, the cause of the matter. I have to address, basically, what are the circumstances that this person is living under? How can I change the environment? Or what can I do? So that's unacceptable, right? I mean, you should get your eyes. It could be age-related. You don't know for a fact.
Yeah, I mean, when you see Dr. Rosa interact with patients, it's actually very phenomenal. He treats them like family. They're very comfortable with him. Even when he has to share very difficult information with patients, it's not in a confrontational sort of way. It's very educational. And you can see that the patients really receive what he's saying to them very well. So he's just a phenomenal individual.
Dr. Rosa, but he's a great guy. I'm appreciative of his existence. I always walk out of his office smiling.
As a matter of fact, we lose, in the United States right now, we're losing 1 out of every 6 minutes, somebody is dying of an overdose. Every 6 minutes. And the highest total of overdoses in the city of New York occurred last year here in the Bronx, and specifically in this particular area code, probably 10457. And again, in this particular area, it's not a quick solution. It's not an easy solution. The fact is that you can't just take a pill. You can't just address one factor. Here at this particular facility, what are the causes of the causes? That's what we try to get to the root of the matter. Addiction and dependency is not curable. Just like high blood pressure is not really curable, diabetes is not curable, there are many forms of cancer that are not curable, but they are treatable.
The South Bronx, one of the most hardest hit communities by the opiate crisis that we have now, and it's one of the hardest communities by every opiate crisis that we've ever had. And to have somebody like Danny Rosa, who could have won anywhere, come here and dedicate his life to these clients, it's very unique. Most doctors will come and work a few years and leave. But Dr. Rosa he dedicates himself to the clients, he's focused on the clients, and he does a great job. So to me, that's it. A local guy who went away, got a great education, great universities, and yet he's back here in the South Bronx doing great work.
Congratulations, Danny. Dr. Rosa, it's really an honor and a privilege to be able to honor you in this fashion.
Danny, you're dedicated to your clients, dedicated to this community. We are proud and honored to have you here at Acacia Network.
All of the members of Acacia, and particularly to our leadership and my clients, patients, I want to thank everyone for, this is an honor that I never possibly could have achieved without the help of everyone that collaboratively has helped me to attain my mission, essentially. So thank you very much.